Hello, this is Dr. Hani Abu-Farsakh. I would like to welcome you today in my clinic where I will perform the physical exam of the lumbar spine on my friend here, Hussam, who we gained his consent to do that part of the video. Unfortunately, we will not do that with full exposure as this cannot be done over the video recording. By doing the lumbar physical exam, I usually start by inspecting the gait while they are walking towards the couch. Yes, so during the exam I will be sometimes talking in Arabic just to try to explain things for him while trying to explain the steps that I do in English as well. By his walk, we can look for antalgic gait or limping or any signs of weakness. Just for example, if he has a drop foot or any kind of abnormality in his gait, we can check that during his gait. Okay. After that, I ask him to lie down on the bed. Okay. While he's lying down on his back, I will start by checking for the straight leg raising. Actually, this is the sequence that I do usually in the clinic, and I prefer to start by the neurological exam. So we will start by straight leg raising over both lower limbs. ارفع رجلك اليمين بشكل مستقيم لفوق. Yeah, you can see if that's full or not, and the other side, excellent. Okay. After that, I progress towards the neurological exam where I ask him to pull his foot towards him. قاومني، خلينيش انزلها لتحت. نفس الشيء هون، قاومني، كويس. ادعس بنزين. ادعس كلتش. ممتاز. الاصبع الكبير شده لفوق، تخلينيش انزله لتحت. نفس الشيء هون. نزله لتحت، خلينيش ارفعه لفوق. نفس الشيء هون. اتني الركبة اليمين، خلينيش امدها قاومني. مدها مد كاملة لفوق، تخلينيش اتنيها. نفس الشيء هون، خلينيش امدها. مدها مد كاملة، خلينيش اتنيها. ممتاز. إحساسك بأصابع يمين وشمال زي بعض. Now I'm checking for the dermatomes, starting from the first rib space, and then medial side of the foot, lateral side of the foot. The same, نفس الشيء، نفس الشيء، نفس الشيء، نفس الشيء. Okay, so we are checking for the that part by doing that part. Now we will progress by doing the reflexes over the patellar tendon and the Achilles tendon. We start that by bending the knee slightly and trying to palpate for the patellar tendon and try to hit it, and I will feel for the reflexes, whether he's having a reflex or hyperreflexia or areflexia as well. After that part, we also go for assessing the upper motor neuron by doing the Babinski test, by progressing with this metallic device over his foot and trying to check if there is any signs of fanning of the toes. And as well, I do the clonus examination over both lower limbs just to check for the upper motor neuron condition. After concluding that part of the exam, we can progress towards the hip examination where we perform the Faber and the Fader test. During Faber test, it might be related to sacroiliac conditions, so I have to ask him for any signs of pain, Faber, Fader as well, and that's it. After finishing the surveillance of the hip, I usually ask him to lie on his tummy as in prone position and try to assess for the spine by palpation during this part of the examination. Okay. During this part of examination, I start by palpating both sacroiliac joints, checking for any pain or tenderness there, trying to check for the paraspinal muscles if there is any signs of weakness or tenderness over them, and as well I try to palpate for over the spine. During this part of examination, I try to check for instability as well by pressing down on the spine, and I ask him to elevate his legs and doing that pressing again while he's trying to do that bending over both hips. ممكن ترفع رجليك تنتين هون على الوركين. Yeah, that's it, and try to push and ask him if there is any pain or not. After concluding that part of the examination, I ask him to sit on the side of the bed to perform the slam test. ممكن انك تقعد على حافة السرير. Okay. بديك توطي رقبتك قد ما بتقدر، ترفع رجليك التنتين لفوق، يا مع شد كفات الرجلين، ممتاز، نزل. And then we can perform by each side alone. Yes, that's good. The other side, yeah, that's excellent. And by that we concluded this part of the examination. هلا بديك توقف. After standing, we can progress to Trendelenburg test, just to assess for the alignment and trying to look if there is any signs of compensation or glutes weakness. ممكن توقف على رجلك اليمين لحالها، على رجلك اليسار لحالها. ممتاز. Okay. دير ظهرك. During this part of the exam, we will assess Adam's test, where we ask him to bend forward. Actually, we are testing two things during this part of the exam: the range of motion and the asymmetry during bending forward. You can notice a list in cases of sciatica. Sometimes there might be scoliosis that can cause asymmetry. So we will perform this part of the exam from the back. ممكن انك توطي هيك ايديك تنتين متوازية متساوي and trying to look over both sides and check for his range of motion as much as possible. ممكن انك توقف. Now, as we started to do this part of the examination, while to assess the range of motion, we can ask him to perform flexion and rotation. ممكن انك تلف للجنة. Yeah, that's for the rotation. The other side. ممكن انك تسوي rotation on the other side. Good. Okay. And now we will do the lateral flexion. ممكن انك تلف على جنبك توطي هيك. Yeah, that's good. On the other side. Okay, excellent. And now we will perform the facet compression test, where I usually try to assess over the right side by bending him to the back and doing the same on the other side. And we can ask him, ممكن انك تعمل extension لورا. If that first exam was not painful, we can ask him to perform that and check for the range of motion concept. ممتاز. هلا بدي اياك توطي تقفز على رجليك وتوقف. Yeah, this is just for the squatting and trying to check for any abnormality in the squatting, signs of weakness. ممكن انك تمشي على رجلين هيك. Yeah, we are checking his heel walking. That's good. Okay. ارجع وانت بتمشي على رؤوس الاصابع. Now on the tiptoes. امشي لقدام. Yeah, and that's part of the power examination as well that we can perform it now. Okay. ارجع. ماشي. By that, we can start by concluding the examination. Usually, I ask him to walk back towards his seat and try to assess his gait during this part, just to check that there's nothing changed after the physical exam. I didn't induce any pain or anything. ممكن نرجع مكانك. Okay. And that's it. Thank you very much, and thank you, Hussam.